And here with answers to your medical questions in our Ask the Doc segment is Dr. Msonthi Levine. So epilepsy is this new treatment. What do you think about it?
Medical science is wonderful.
Yeah, it is.
We're always thinking about new things, how to treat illnesses. Seizures is a big problem and certainly can be very terrifying and limiting. With seizures, a lot of people can't drive. It can be very impactful. They can injure themselves. The medicines actually have gotten pretty good as well, but it's always nice to have some other technologies, some surgical procedures that work really well. This is certainly not something they jump to initially. Normally these are patients who have failed medical therapy and nothing else is available, and so these techniques are out there. I don't know if they're doing it locally here, but it's nice to know that it does work and it's effective, because they do have a small percentage of patients out there who don't respond to medications.
Okay, on to some of our viewers' medical questions. Let's see. This person says, what causes the right arm weakness and the inability to raise it and reach?
I probably would think of a pinched nerve in the neck, probably related to cervical degenerative joint disease, or a pinched nerve. Probably would do an x-ray or an MRI to look at that. Most of the time this can be treated non-surgically, but sometimes they do need surgery.
Okay, another question. I have a twinge in my left arm. Sometimes I can't pull it back to take off my jacket or pull it over my head to take off or put on a blouse, and it hurts when I lay on it. Any idea what it could be?
It could be something similar, but another thing I would think of is a shoulder or rotator cuff. Sometimes it degenerates, it gets torn, it's inflamed, and sometimes limits range of motion with certain activities, and a lot of times it does hurt at night when you lay on it. A lot of times we treat that with anti-inflammatory medications, tablets, or gels that can be rubbed on the shoulder. We can do MRIs as well. We can inject the shoulder. A lot of different things that we can do for that problem.
Okay, another question. I'm breaking bones due to taking chemo. How can I help myself? I need a doctor, yet doctors have stopped taking Medicaid. I hurt.
Well, certainly talk to the physician who's giving her the chemotherapy. A lot of times they have to stop therapy and switch to something different. Just like seizure medications, chemotherapies are getting better, less side effects. They only do what they're supposed to do. It is unfortunate that a lot of physicians do not take Medicaid. A lot of times you can call the Medicaid office and see who is taking Medicaid in this area.
Okay, another question. What does it mean when you get those awful smelling things in your tonsils that pop out when you have a sore throat? Ooh.
Yeah, tonsils have little crevices or pits in them, and unfortunately when you eat, if you have big pits, then food basically gets caught in there. It's just old food and debris. Sometimes can be very smelly, and so a lot of times they can fall or pop out. If it is bad, certainly get to the ear, nose, and throat doctor. Maybe the tonsils can be removed.
But it's not necessarily an infection.
It can be a low-grade infection, but it's not anything that necessarily requires antibiotics. A lot of times, again, if it is painful and swollen, you're having a lot of fever, then obviously I would give antibiotics. But a lot of times it's not on that level, but a lot of times a bad breath that they get is a result of a low-grade infection.
All right, we've got lots of other questions. We'll get to those in just a minute,
Yes,
so don't
ma'am.
go away. Dr. Levine will answer more of your questions next on Live at 5. We're back with Dr. Msonthi Levine to answer more of your medical questions. This person is a woman that's been diagnosed with a hiatal hernia. If it's not repaired, what are the consequences? She wants
Really
to know.
not much. If a person's not having any symptoms from it, nothing really has to be done. We only repair it if they fail medical therapy. A lot of stomach pain, nausea, vomiting, not able to keep any food down, weight loss, bleeding. That's really the only time to repair it, but you can live with it. It's not a problem.
Okay. What is impulse control disorder and what does it cause?
Not quite sure. That's a new one for me. It's obviously a psychiatric illness. Probably a psychiatrist would see that patient. A lot of times we use antidepressants and antipsychotic medications to help control. I'm assuming based on the name, this person is having a lot of problems with impulse. We have to be aware of our environment and not act on impulses that are socially unaccepted. So I'm assuming it's some sort of illness like that. As a medical doctor, we like to make sure it's nothing medical, obviously, and would do a nice little panel to make sure, but probably the psychiatrist would manage that.
Okay. How long can someone stay on hydrocodone for a sciatica bone disorder?
We try to get them off as soon as possible. As we know, hydrocodone is a narcotic. A lot of things are changing with prescribing narcotics these days. Actually, hydrocodone probably will be a type 2 type of pain medication, which will make it more difficult for patients to get it and physicians to prescribe it. A lot of problems with narcotic abuse out there, so we try to get them off off as soon as possible, but there are some patients who require it long term, several weeks, several months. We a lot of times will send them to chronic pain management doctors. They are more intense about monitoring the patients who are on chronic narcotics, so as soon as possible is the answer.
Now, as far as hydrocodone, if you've been on it for a while, do you just stop taking it or do you try to wean yourself off?
I think if you're having side effects to the medication, yes, we have to stop taking it because that means you have toxicity, and toxicity can kill you. I've seen it certainly in this area, so we will abruptly stop the medication. But I think if you're not having that and you're working with your physician, your pain is better, probably weaning off the medication is not a bad idea. But there are a lot of patients who do abruptly stop the medication and don't have any problems.
Okay, some other viewer questions. What causes my hands to go numb and hurting on and off? They've been doing it for quite a while now.
Yeah, probably the nerve disorder, like a pinched nerve, which would happen in the back, or the wrist, the elbow. A compression neuropathy is what we call that. X-rays, such as an MRI, would probably evaluate that. And a lot of times surgery is necessary if the numbness, tingling, and pain and weakness persist or progress.
Would that have anything to do with like carpal tunnel syndrome?
Absolutely. That's a compression neuropathy. We can a lot of times relieve that with anti-inflammatory medicines, injections, or a wrist splint that you can pick up at most pharmacies. You can wear that at nighttime.
Okay. What can I do for high-pitched ringing in the ears?
A lot of times that means you have illness or disease in the middle ear. That's kind of an emergency, meaning you need to get that evaluated fairly rapidly, because if you wait a long time, the ringing may persist. There's normally steroids that we give for that high dose, about 60 milligrams. The ENT doctor normally do an evaluation, normally an MRI, to see what else is going on and try to come out with a diagnosis. So in my thing, if you have ringing, get to the doctor as soon as possible.
All right, Dr. Levine, unfortunately we are out of time, but we appreciate you being here.
Yes, ma'am.
And you can always visit our website and see the answers to these and other medical questions posted online. And if you'd like to have Dr. Levine answer your medical question, you can always mail us at the address listed on your screen, fax us 892-7305, email us at laf@kftm.com, or post those questions every Monday on our KFTM News Facebook page.